Okay, so you're here with us on the deep dive because, well, pills and injections, they're not always the most exciting or even the most effective way to get medicine into your system, right?
Right.
And that's exactly why we're going deep today into the world of drug delivery systems. We want to explore how scientists are like really getting creative to make sure medicines hit their targets, are safe, and even, easy to use.
Yeah, and we're not just talking about like minor tweaks. I mean, we're talking about a whole spectrum of technologies here. We're talking about things from like nanoparticles, which are unbelievably small,
hmm
to implants, like
hmm
the whole game eat.
Yeah. Yeah. I mean, I was reading about these nanoparticles before. It's like mind blowing how small they are. We're talking like 1 to 1,000 nanometers. Like, what even is a nanometer?
Right. Well, a nanometer is 1 billionth of a meter, so it's incredibly tiny.
Okay. So tiny. But like, what's the big advantage of being that small when it comes to drug delivery?
Well, you see, it's all about taking advantage of how our bodies work at that microscopic level. So think about it this way, right? In certain areas, like, say, around a tumor, the blood vessels can be a little bit leaky, and these tiny nanoparticles, they can kind of slip through those gaps. That's what we call the EPR effect, like enhanced permeability and retention.
Oh, EPR. Okay. So it's like kind of sneaking the medicine in almost.
Exactly. It's a form of passive targeting, you see. And it's not just that. We can actually engineer these nanoparticles, right? Like stick specific molecules on their surface. It's like giving them a little address label to find exactly the right cells.
Wow. That's like super targeted therapy right there.
It is. It is. And on top of all that, these nanoparticles can actually shield the drug,
Mhm.
protect it from breaking down too quickly in the body. And they can even be designed to release the medicine slowly over time, you see.
So it's like not only do they get to the right spot, but they also like deliver the medicine in a much more controlled way.
Precisely. That's what we're aiming for. Precision and control.
Okay. Now I'm curious about the materials, right? Because we're talking about putting these things in the body. So what are they actually made of, these nanoparticles?
Well, there's a whole range, really. Like we have uh, biodegradable polymers, things like polylactic acid, PLA, or polyglycolic acid, PGA. Sometimes they're combined as PLGA.
PLGA. Okay. What's so special about them?
Well, the beauty of these is they break down naturally in the body, you see. They release the drug, and then poof, they're gone. And then for drugs that aren't so good at dissolving in water, we have these things called solid lipid nanoparticles, SLNs. They're great for that.
Interesting. So it's like picking the right material for the right job, right?
Absolutely. And then we go even further. We have metallic nanoparticles, gold and silver. And it's not just about delivery with those. They can be used for imaging, even therapy, all at once. That's what we call theranostics.
Theranostics. That sounds so futuristic, like diagnosing and treating at the same time.
Exactly. And the innovation doesn't stop there. We have inorganic materials like silica and carbon-based ones, think graphene and nanotubes. They each bring their own uh, unique advantages to the table, whether it's stability or interacting with our biological systems in interesting ways.
Okay. So we've gone super small with nanoparticles, but then there's also these microparticles, right? I mean, they're still tiny, but they're bigger than nanoparticles, like what, 1 to 1,000 micrometers, right?
Yeah, you got it. A micrometer is a thousandth of a millimeter. Still incredibly small, but yeah, bigger than nanoparticles.
So what's the benefit of going slightly bigger?
Well, the main thing is that we can get these microparticles to release the drug over a much longer period. We're talking days, weeks, even months.
Yeah.
So that makes them really useful for things like, those injectable depots or implantable devices that can deliver a steady dose of medicine.
So it's like long-acting medication, right? You get one shot and you're good for a while.
Exactly. And there's some really interesting research going on with using them for oral delivery too, you know, because the microparticles can actually protect the drug as it goes through your digestive system. Pretty cool stuff.
Oh, I see. So it's like little protective shield for the medicine as it travels through your stomach and all that.
Yeah, exactly.
Okay. Now these dendrimers, these are the ones with like a really unique structure, right? They're like highly branched, almost like a tree.
Right, exactly. Think of them like tiny trees with lots of branches. And those branches, that's where the magic happens. They provide tons of surface area and space inside so we can pack in a lot of drug molecules.
So it's like maximizing the cargo space.
You got it. And the coolest part is we can actually modify those branches,
hmm
give them specific properties to fine-tune their release and even target them to specific cells.
So it's like building a custom delivery vehicle, basically.
Yeah, pretty much.
Okay. Let's talk about hydrogels. Those sound pretty interesting. They're like these water-loving polymer networks, right? I mean, that sounds like they'd be pretty friendly to the body.
Yeah, they are. They're very biocompatible because of all that water. And they can be used in so many ways. We can inject them as a liquid, and they'll form a gel right inside the body, or we can implant them as scaffold, even use them in transdermal patches.
Wow. So, like, a lot of versatility there.
Oh, yeah, for sure. And one of the big advantages is that they can release drugs really slowly and steadily. And get this, some of them can actually change how they release the drug based on the environment around them. Like if the pH changes or the temperature goes up, they'll react to it.
So it's like they're smart materials. They can adapt to what's going on in the body.
Yeah, it's pretty amazing stuff.
Okay. And then there's these things called polymeric micelles. They're like nanoparticles, but they kind of form on their own, right? Through self-assembly. What's the deal with that?
All right, so polymeric micelles are actually pretty cool. They're made from these things called block copolymers, which are kind of like molecules with two personalities. One part of them loves water, the other part hates it.
Oh, I see. So it's like oil and water. They don't mix.
Exactly. So when you put these copolymers in water, they spontaneously form these tiny spheres, and the water-hating parts clump together in the center, while the water-loving parts form a shell around them.
So it's like a tiny little bubble with a special core.
Yeah, think of it like that. And that core, that's where we can put the drugs, especially the ones that don't like to dissolve in water.
Ah, I see. So it's like a little protective capsule for the medicine.
Yep. And the cool part is that shell around the core, it actually helps the micelle to avoid detection by the immune system. So it can circulate in the blood for much longer, increasing its chances of reaching its target. We call that the stealth effect.
The stealth effect. Nice.
It's pretty sneaky, huh?
Definitely. Okay, now let's talk about drug conjugates. Those sound like they're all about precision targeting. So what are they exactly?
Well, a drug conjugate is basically like attaching a drug directly to a carrier molecule. Think of it like hitching a ride.
Okay, so who's driving and who's the passenger?
Well, one of the best examples is the antibody-drug conjugate, or ADC. Here the driver is an antibody, a special protein that can recognize and bind to specific markers on cells, like, say, cancer cells. And the passenger is a powerful drug, often a chemotherapy agent.
So it's like a guided missile going straight for the cancer cells.
You got it. The antibody takes the drug right to the target, minimizing damage to healthy cells. Pretty awesome, right?
Yes, incredible.
And there are other types of conjugates too, like polymer drug conjugates. Here, the drug is attached to a polymer, like polyethylene glycol, or PEG.
PEG. Okay, what does that do?
Well, attaching PEG can do a few things.
Yeah.
It can make the drug last longer in the body, improve its solubility, how well it dissolves. Basically, it helps the drug to behave better.
So it's like giving the drug a little upgrade.
Yeah, you could say that.
Okay. Now, moving away from the tiny stuff, we have implants. Those are for like really long-term drug delivery, right? Weeks, months, even years.
That's right. Implants are all about sustained release. They're surgically placed, you know, and they're perfect for conditions that need constant medication, like hormone replacement therapy or contraception.
So it's like having a little medicine factory right inside you.
Kind of, yeah. And they can be made from materials that break down over time, so you don't have to worry about taking them out. Or if they need to be removed, we can use materials that don't break down.
Okay. Now, transdermal patches, I mean, everyone's seen those, right? They're like super convenient, but what actually makes them work?
Well, they deliver the drug through the skin and into the bloodstream. So you don't have to swallow anything or get a shot. But the skin is a tough barrier to cross. It's like a fortress. So patches work best with drugs that are potent and lipophilic. That means they can dissolve in fats and oils, which helps them to get through the skin's defenses.
So it's like finding the right key to unlock the door into the body.
Exactly.
Okay. Inhalers, I mean, obviously those are crucial for people with respiratory problems, but I've heard they can also be used to deliver drugs systemically. How does that work?
Well, yeah, you're right. Inhalers are best known for treating lung conditions like asthma and COPD. But the lungs, you see, have this huge surface area, which makes them great for absorbing certain drugs into the bloodstream.
So it's like a back door into the circulatory system.
Yeah, you could say that. And there are a few different types of inhalers. There's the metered dose inhalers, the MDIs, which use a propellant to push the medicine out. Then there's the dry powder inhalers, the DPIs, which use your own breath to deliver the drug. And then there's nebulizers, which create a fine mist that you breathe in.
Okay, so a lot of options there. Now, what about these microneedles? I've seen those online. They look pretty cool. And a lot less scary than regular needles, so what's the deal with those?
Microneedles are actually pretty amazing. They're so tiny they can pierce the skin without causing pain.
Uh,
And they create these microscopic channels that allow drugs to pass through.
so it's like a stealthy way to get medicine into the body.
Exactly. And the best part is they can deliver larger molecules like peptides and proteins, which are usually hard to get through the skin.
Oh, I see. So they open up a whole new world of possibilities for drug delivery.
They do.
Okay. Now, we also have to talk about the eyes and the nose. I mean, those are pretty challenging areas to deliver drugs to, right?
Oh, for sure. The eye especially has these really tight barriers to protect it, so it's hard to get drugs in there effectively.
Yeah, I can imagine.
Right. So we have the usual eye drops, but they often don't work that well because the drug just washes away. And then there are more advanced options like ointments, inserts that release the drug slowly, even contact lenses that release medication. And in some cases, we have to resort to injections directly into the eye. Yeah.
Wow.
And the nose, well, that's a bit easier. We use nasal sprays for things like allergies and congestion. But the cool thing about nasal delivery is that it can also bypass the first-pass metabolism in the liver, meaning the drug gets into the bloodstream faster. And some researchers are even exploring using it to deliver drugs to the brain.
Wow. So like a direct route to the brain?
Yeah, potentially.
That's incredible. Okay. And lastly, we got to talk about the mouth and the GI tract. I mean, that's a classic route for drug delivery, right? But there's still a lot of innovation happening there, right?
Oh, absolutely. So we have things like buccal and sublingual delivery,
Mhm.
where you place the drug under your tongue or against your cheek, and it gets absorbed directly into the bloodstream, bypassing the liver.
So it's like a shortcut for the medicine.
Yep. And then for the GI tract, a lot of the focus is on protecting the drug from the harsh environment of the stomach, and also making sure it gets released in the right part of the intestines.
So it's like designing a delivery system that can survive the digestive system's obstacle course.
Exactly. And we have things like enteric-coated tablets that only dissolve in the intestine, and colon-targeted systems that release the drug specifically in the colon. It's really about fine-tuning the delivery to get the best results.
It's amazing how much thought goes into all this.
It really is. And at the end of the day, the choice of which drug delivery system to use depends on so many factors, like the properties of the drug itself, what you're trying to treat, and the needs of the patient.
So it's like a personalized approach to medicine.
Yeah, that's the direction we're heading in. More personalized, more targeted, more effective.
This has been an amazing journey through the world of drug delivery systems. I mean, it's clear that scientists are constantly pushing the boundaries and coming up with new and innovative ways to deliver medicine.
It's truly inspiring, isn't it?
It really is. And it makes you wonder what's next. I mean, with all this innovation happening, what kind of crazy drug delivery systems will we have in the future? Something to think about, right?
Absolutely.
Well, that's all the time we have for today's deep dive. Thanks for joining us.
It was my pleasure.
And as always, keep those brains buzzing. We'll catch you next time.